accommodative, especially to gender aspects. We are also glad to have with us Dr. Lynette Ochuma, who is Acting Secretary at State Department for Social Protection and Senior Citizens Affairs. She's an experienced lady and currently is serving at the State Department. And here she represents the government of Kenya in general. And she coordinates community capacity, support and development program, disability services, and family promotion and protection initiatives in the country. With that 1 year of experience in the public sector, she brings extensive expertise in social development and social protection. She has actively participated in the development of policies and their implementation in the social protection sector. So we are glad that we will have to harvest today that knowledge of expertise. We also have from Uganda, Beatrice Okilani is the Social Protection Policy and Advocacy Coordinator in the Expanding Social Protection Program under the Ministry of Gender, Labor, and Social Development. She leads a team that is responsible for establishing a comprehensive social protection system for Uganda. This role involves coordinating the development and implementation of the National Social Protection System for Uganda. And Beatrice has led the team that developed and drafted the National Social Protection Policy and its program plan of implementations. Earlier, as a Principal Social Development Officer in the Ministry of Gender, Labor, and Social Development, she was the brain behind the design of the Expanding Social Protection Program, a program which birthed the National Social Protection Policy and Popular Social Assistance Grants for Empowerment Program. So we are glad to have her here to represent the government of Uganda and really elaborate to us, especially from the policy perspective, how it goes. We are also delighted to have Nazia Mokwit, who is a social protection specialist at the World Bank. She is a social protection specialist at the World Bank, where she leads country engagements for the Partnership for Economic Inclusion. She specializes in program design, capacity building, and policy dialogue related to economic inclusion programs. In previous roles at the World Bank, she provided technical assistance on social protection operations aimed at increasing female labor force participation, offered policy guidance on childcare service delivery, and conducted analytical work on gendered norms in South Asia. She also supported the design of an economic inclusion pilot in Iraq and contributed to a global diagnostic that examines the impact of access to water and sanitation on human development outcomes. With our passion on inclusion, social inclusion, we are glad to have her here, and we will harvest from that expertise as the webinar progresses. At this moment, I would like to invite the ICRW Africa Director, Evelyn Opondo, to just let us know what ICRW is doing and maybe highlight. I know this social protection is a subject at her heart. We would be glad to hear what she has to say this afternoon. Welcome, Evelyn. Thank you.
Thank you, Lynette. And distinguished guests, colleagues, friends, and partners, good afternoon. As you've been told, my name is Evelyn Opondo. I'm the Africa Director at the International Center for Research on Women. Thank you so much for making the time to join us in this important discussion on social protection. Ladies and gentlemen, I just want to start with the reflection that is important to us. We know that when women thrive, nations prosper. And across Africa today, There are too many women and girls and structurally marginalized populations who are carrying the heaviest burden, right from rising food prices, climate shocks, unstable jobs, endless unpaid care work. Yet the systems that are meant to protect them often leave them behind. At ICW Africa, we exist to change that. For over 30 years, with a single mission of advancing rights and opportunities for women, girls, and structurally marginalized populations, ICW has worked in more than 25 countries across Africa, and we've been turning groundbreaking research into gender transformative action, research such as the one that we will share this afternoon. We don't just study inequality, we challenge it. And today's webinar, which is themed as what works for advancing gender responsive social protection, is part of that mission. Over the past 2 years, we've been privileged to have the generous support of the Hewlett Foundation. And we have acted in partnership with our technical advisory groups in Kenya and in Uganda. Together, we have listened closely to women in informal work. We've listened to caregivers, to widows, to persons with disability, to young mothers, and to policymakers and implementers of social protection system. And there's one resounding message that is very clear from what we have heard. And it's the fact that gender responsive social protection is no longer optional. It is essential. When we get it right, we reach more women and marginalized populations. We stabilize incomes, we open pathways for livelihoods, we improve health and education outcomes, we strengthen resilience to shocks and deepen accountability, and we make every shilling go further. But we also know that research alone changes nothing. Action does. And that's why for today, more than just sharing the findings of our research, it's about also agreeing on what the quick wins are and the bold steps that we must take together. I want to take this opportunity to, really thank the technical advisory groups in Kenya and in Uganda for their guidance, right from inception to interpretations of the data that we found. I want to thank the women and the households who so generously shared with us their experiences, and also our field team and partners who ensured ethical and inclusive data collection, and to the policymakers who supported us in this endeavor and who are here today and who will walk this journey with us until we see that the women realize the change that we all aspire for. Finally, we are very honored to have representatives from Uganda and Kenya and from the World Bank on today's panel. Together, we have the knowledge, we have the partnerships, and we have the tools to turn evidence into lasting change. ICW stands ready as your trusted ally, bringing in that evidence and practical solutions to help us move from insight to impact, and to make that impact felt in the communities across our nations. We are counting on your leadership and your determination, and we know that together we can make these recommendations transform lives and be more than just mere recommendations on paper. Once again, I thank you for your time and for your dedication on this very important topic. Karibuni, and thank you.
Thank you, Evelyn, for those insightful remarks. Let's hear what, just a preliminary of what the research is all about. I think the video, we can be working on it and then play it later. So just to save on time, I would like us to quickly hear what the women are saying from our colleague Chirabo Suubi from Uganda, so that we can really get to hear what they found, together with Crispin from Kenya, what they found, what the women are saying, what can we do to make the social protection work for those who really need the service. Welcome, Chirabo. Please proceed.
Thank you, Lynette. Chirabo Subi is my name, a research scientist with the International Center for Research on Women. So I'm going to be sharing with us the findings from our research that we undertook as ICRW. The study took place from September 2023 until recently, when we have synthesized the findings from the various studies that we undertook. And this is the presentation. So we know that social protection measures address poverty, vulnerability, and social exclusion among the most vulnerable members of our society. Effective social protection programs are urgently needed, especially in Sub-Saharan Africa, where we have over 1.2 billion people, mostly who are women, who have no social protection coverage. Only about approximately 19% of Africans have received at least one social protection benefit. And most of the countries in the region, Sub-Saharan Africa, spend less than 5% of their total gross domestic product on social protection. In the region here, Uganda spends only about 0.7% of its GDP on social protection, excluding healthcare. In Kenya, it is about 1.4% only. In Rwanda, it is at 1.3%, and Tanzania at only 2.5%. Women face disproportionate exclusion due to informality, the care burdens that they face, the weaker delivery systems. There are also other structural barriers that are in place that distract women or barrier them from receiving appropriate social protection benefits, including their concentration in the informal economy, mainly the lower wage rate that many of the women receive, the limited access to assets, the entrenched gender norms. It was very imperative for us to understand what experiences and preferences vulnerable women have around social protection programs. We know a lot of statistics around social protection. There's some literature out there, but we know very little about experiences and the perceptions or preferences of women, especially vulnerable women, regarding social protection programs. And yet, the vulnerable women may not be reached through contributory social protection schemes and other schemes, and yet they're expected to be part of the beneficiaries of the social protection programs that are put in place. There is also scarcity of evidence around the experiences of social protection policy actors regarding how social protection is going on in the country, how they experience the designing, the implementation of the different social protection programs that are put in place. Because getting these views from them would help around improving the design and implementation of the social protection programs. It is against this background that we thought it is very important for us to generate evidence on what makes social protection programs effective for women. And then to also address the question around understanding women's experiences, their preferences for social protection design and delivery, and also exploring policymakers' perceptions around the implementation challenges and the evidence needs that they have regarding social protection in Kenya and Uganda. So the design for this study, we undertook a mixed methods, which was in 2 phases. The first phase was a scoping review where we synthesized existing literature, published literature that is peer-reviewed on what works for women in Africa, across Africa. We got literature from several databases, and we read the literature, we synthesized the findings, and then we're able to come up with to understand the evidence of what works for especially women in Africa. The video that we're supposed to play earlier will highlight more of those findings, and some of those we are going to share them in the presentations today. The second phase of our study was the primary research that mainly centered on marginalized women, including women who are widows, women who are elderly, women who have a disability, women who are in the informal sector, women who are in the remote and rural areas and the like. And we're also able to have conversations, key informant conversations with social protection policy stakeholders that are in government, that are in the civil society, in the NGO world, in academia, and development partners. The core questions for our study was what works for women, what social protection measures work for women, and this was addressed during the scoping review. The second research core question that we looked at was, what do women want from social protection design and delivery? And then what are the challenges and the policy, the evidence gaps, for policymakers who are in the social protection space. So around the sampling, regarding the women, we looked at women in the rural areas. We got representation from women who are in remote and rural areas, and then urban informal settlements. We also got stakeholders who are in the policy making space around social protection, and I've mentioned some of those in government, in academia, in the CSO, amongst the development partners. We undertook around 60 in-depth interviews with vulnerable women in urban and rural areas, informal urban settlements, and then about 46 focus group discussions with women in homogeneous groups, those ones in rural and remote settings, and the others who are in urban informal settlements. We also had around 19 key informant interviews, and this was mainly in Uganda with the policy makers. And the recruitment, we did this via the networks that we had, but also the fact that at the very beginning of this project, we instituted technical advisory groups in both countries, in Uganda and Kenya. And in these groups, we had representation from government, from academia, from the Bureau of Statistics that are take on these countries. So we had that representation. And this group was very key in advising us on every step as we're going through this particular study. So we also utilized the networks that were from the technical advisory groups and the snowballing as we were talking to the different respondents. They were referring to us, to other respondents and the like. We, of course, followed all the ethical research procedures, including having informed consents, requesting for permission around audio recording, and we went ahead to de-identify the transcripts when we're coming from the field and during the process of analysis using in vivo. Before we went into the field for this study, we received ethical approval from the different key institutions in Kenya and Uganda. And from the different products that we've got from this study, we have reports, we have the briefs, and these are going to be shared in the chat. The QR codes will be shared in the chat as we go along. You'll be able to see all the details in terms of findings of the study. What we are sharing this evening, it is just the highlight of the findings. So these are the findings from Uganda. From the different reviews, literature review that we undertook, we know that Uganda's social protection system is fragmented, underfunded, and currently has a limited reach, with only 3% of the population being covered by social protection schemes. Social protection spending, I mentioned this, excluding healthcare, is at 0.7% of the national GDP. In Uganda, we have a policy, the National Social Protection Policy of 2015, and the recent Social Protection Strategy of 2024 to 2028. The Ugandan constitution as well provides mandate around social protection for its population. However, even though we have the different, this policy framework in place, the social protection system in Uganda still needs more strengthening, and some work needs to be done. In the recent report of 2024, the annual report of social protection, it shows that only 6.2% of the population received at least one social protection benefit as of 2024. And only 1.2% of the vulnerable populations received social assistance. 2.5% of the population had health insurance coverage. In Uganda, we do not have the national health insurance coverage yet. So it is still on a private basis, and only 2.5% was covered by the different existing health insurance in the country as of 2024. Amongst the persons who are 60 years and above, only 21.9% benefited from at least one social protection scheme in the country. Looking at the findings from the women when we were talking to them, capturing their voices, we found that women showed a high level of awareness around social protection programs, especially government social protection initiatives that target livelihoods, economic security, including the program that provides financial support to the elderly, the parish development model, the EMIOGA, these are livelihood programs. The parish development model and the EMIOGA livelihood programs, they are under the complementary service group of social protection. And then women were also aware of their health and education focused programs, such as the universal primary education and the universal secondary education. Women noted saying, some of the women noted saying that they currently take their children to the government-aided schools at primary level and secondary level. And some of them even mentioned that they also attained this education or their education from government-aided schools. Women were also aware of social protection programs that are provided by development partners and NGOs and other private providers. Most women, however, mentioned that they learned about social protection initiatives informally through friends, the local leaders in Uganda. Here we call them, especially in the central, we call them the Nabachala, and through word of mouth rather than the formal channels. So they did not get much of the information around social protection through the formal channels. Women, there was some other thing that was interesting. Women perceived social protection as a right and entitlement. And looking at the different groups, amongst women with disability and women who are elderly, they viewed social protection as a right and an entitlement. They saw that they were entitled to receive support from government. However, other women viewed social protection as a charity, as a favor from government or from the organizations that are providing it. So that is something for us to think about this evening around how beneficiaries perceive social protection. Looking at women's experiences in terms of benefits and barriers, these were mixed. On one hand, many women acknowledged the benefits that they have received from social protection programs, such as free maternal and child health care, especially from the government-aided hospitals or health centers, and the health camps that are put in place by NGOs and other providers. They also acknowledged access to education for their children and opportunities around skilling and entrepreneurship that they received from especially programs that are focused on livelihood improvement. They also acknowledged improved their food security from programs that focus on food security and the overall improvement around household well-being. Some of the women were quoted saying, "I've been getting free treatment in government hospitals and I have delivered all my children there from the firstborn to the last. I also take my children to UPE, and that is the Universal Primary Education and Universal Secondary Education schools. And they also mentioned that they also obtained education from government schools. However, on the other hand, there were significant social protection access barriers that were reported. For example, unsuccessful attempts to access social protection benefits due to limited social networks, lack of information, or discouraging experiences. Women, especially who are in remote and rural areas, some of them have limited social networks. So they do not have many people to learn from about what is really going on, except when they go to the small trading centers, and then they hear people talking about a program and then they get to know about it. But in some instances, the program may be registration has been completed for the would-be potential beneficiaries. And also the other thing was the discouraging experiences. When a woman gets an experience that is not very good around social protection program, they'll go singing about it to everyone who can hear it, even to their colleagues. So some of these discourages some of this information, then discourages the other from taking on registration for them to access social protection. However, women who accessed social protection benefits, some of them described them as insufficient because sometimes the monies are limited if it's the cash transfers, sometimes they are irregular. And then they also reported the hidden and unanticipated costs or unofficial fees that they incur while trying to access social protection programs. One woman was quoted saying, "When you listen to the radio, they always announce that the parish development model is free don't pay any money. But the local official in the area will tell you, if you don't give me 100,000 Ugandan shillings, you won't get anything. By the time you finally receive the 1 million Ugandan shillings, you've already spent 400,000 Ugandan shillings. Then you realize that out of that 1 million Ugandan shillings, you are supposed to receive 500,000 because the other half has already been used through the hidden fees or unofficial fees or unanticipated costs. Yet at the end of the day, they are required to pay back the 1 million shillings that they received as a loan. The selection process for the beneficiaries was also perceived as opaque, unjust, and marred with unexplained deduction. There were cases of favoritism that women talked about, nepotism, and the corruption. This is like an open secret in our community. Corruption is still there. So we need to devise means as policy actors to see how can we reduce experiences of corruption in social protection programs. Women also mentioned the stringent documentation requirements, the complex eligibility criteria, and the bureaucratic hurdles, and especially for women who are in the rural areas. Some of these, as people who have gone to school, we can see the list maybe asking for a particular, maybe national ID, a particular document, a passport photo, and we see these things as light. But for some people, especially the illiterate, these requirements seem a bit complex for them. Low literacy in rural areas compounded these challenges, making it difficult for some women to navigate registration and the application process around social protection programs. Women in the rural areas and those with disability or having caregiving responsibilities struggled to access social protection services due to distances involved to the service points or high transportation costs, especially in instances where a woman is required to travel from their home or from their working area and move to go and do the registration at a different point. But then maybe they're even required to follow up and go back and follow up and see whether maybe their name or there is something else that is required in addition to the registration that was given. Yeah. So those high transportation costs, the long distances, the absence of disability-friendly infrastructure, especially in buildings that are in structures that are in rural areas, about women to fully access social protection programs. One woman with disability mentioned that the stairs are not favorable for people with disability like us. I stopped using government health institutions despite their free services. Another one mentioned, imagine moving from here to the main hospital when you have a very sick child to get free treatment. You might reach when the child is in very critical condition due to long distances. There were also quality concerns in health and education-related social protection programs. Women reported that the public schools, though supposed to be free, they are often crowded, understaffed, and demanded fees, deterring some families from enrolling their children. And also, there were cases of public hospitals that were reported, especially around lack of essential medicines or medicines not being there on time, the equipment, having less qualified staff, and some women reported neglect and abuse when seeking care from some of the health facilities. One woman, and this is the last quote that I'm providing.
Maybe Chirabo, you can summarize as you conclude. Thank you.
Yes, absolutely. And this is one quote that was provided by one woman. She mentioned, I vowed never to go back to that hospital for the rest of my life. Although the services were free, but because I unfortunately lost my child during birth due to negligence, in that process, another woman was giving birth, but the nurses didn't seem to care as they were eating watermelon. They were called and they refused to come, even though I had just lost my child. So those are some of the experiences from the women. Quickly, as I round up, some of the aspirations for improved social protection programs from the women. Women want simplified and inclusive eligibility criteria for these programs. They want fair and transparent beneficiary selection process in place. They want for them as women to be actively involved in the program design and to have representatives for vulnerable women groups. They also prefer to have transparent and accountability measures in place, especially where cases of favoritism, nepotism, and corruption are involved. They also prefer to have sustained investments in service quality and infrastructure. Thank you so much.
Thank you, Chirabo, for the insightful experiences from women in Uganda. Let's just have a moment to hear what the women in Kenya are saying so that we can have cross-country learnings and find out whether there are any similarities to what they aspire to have with also the Ugandan women. Welcome, Crispin.
Okay, thank you so much. And I think, Chirabo, you could help move the slide to the next. As we get to the next slide, I think, and as it's been sufficiently indicated and said, of course, this was a cross-country study just to also get the aspirations, the desires, and the perspectives, and of course, the lived experiences of women and the categories that had been already given, which are really marginalized. And in Kenya, our constitution is very clear in Article 21, 43, 53, and even 57, as far as social protection and social security is concerned. And also we have seen it there has been a lot of progress from healthcare to pensions and everything in between, including cash transfers. And of course, we are lucky to have a senior government officer here who would even clarify further in terms of provision of further information. But most importantly is to get the percentage of women who are in need of social protection measures to be cushioned, because everyone is a candidate of this. At the moment, we are talking about over 74% of women being in vulnerable employment spaces and within the informal economy sector, where, of course, they're exposed to different shocks. And all those shocks would definitely make them vulnerable if they're not adequately cushioned. And so among the questions we are asking on, how would they want to experience it better and what will they need in terms of design? Here are some of the findings. Go to the next slide. And then in this slide, something that was, of course, even without looking at the many things that are in there, of course, quickly for someone else who might wonder, where did we do this? Of course, in Kenya, as it was said earlier, we looked at different categorization of women in the urban areas, of course, Nairobi being one of them, being the main area that is that gave us the focus, the view of the urban setup, but also Laikipia on the other side, which is a rural area, and the majority of the women are in the pastoralist businesses. And of course, this would help us to create the different delivery realities between the two counties, where one, for example, in Nairobi, in a rental house, there is a cost in terms of mobility. And then, of course, on the other side of Laikipia, when it comes to digital reach and other segmentations, which would help us to bring out the extent of marginality of the women that we were actually focused on. So the rest of the details are included here, looking at, for example, the amount of monies they are making per month, which will be under 5,000, majority of them, up to 56% of those that responded. And very few, of course, are making anywhere in between 5,000 and 20,000 thereabout. And so this, of course, helps us then to have an idea that underscores the need for predictable transfers. This in terms of cash transfers and then looking at the livelihood ladders as we make the social protection mechanisms or interventions more responsive to different needs of these women at different places. We can go to the next slide, which then we'll get to hear what were their experiences. And just like in Uganda, of course, there is high awareness of these social protection programs here in Kenya as well. And most of them being those that are advanced, especially to in Kenya, for the Kenyans who are here, you might already be knowing about Inua Jamii, which has been a very popular one for quite some time. The cash transfer to the older person, 70 years plus, the cash transfer to orphans and vulnerable children, and of course the hunger safety net programs, which have been there for a number of years, but of course focused on the northern frontier districts. And in all this, of course, there is the women as well. They would tell us that indeed they have benefited from some of those cash transfers, the bursaries, the food subsidies, free maternity or health coverage. And of course, why we are still using NHIF as of this time is back in 2023, when, of course, the initial data collection had been done, it was NHIF. And of course, now we are talking about social health insurance fund, that is SHA and SHIF. And all this, these women were actually aware, and of course they could say how they benefited. But beyond the benefit, the next slide will tell us something else. That these women, whereas they were aware, they would on one side say yes, they access the resources that they've received. If it's the 2,000, if it's the hunger safety net program that brings in food rations, if it's support in terms of the children who are orphaned, this would help improve access to healthcare, to education, and of course, help them really earn an income and also make some savings, though it's quite small, the margin is quite small. And the hunger safety net program, for example, for those who in Laikipia, they could say it really helped to cushion them against food insecurities that are caused by effects of climate change, including droughts. And they could also say that, yes, it's not always easy to get some of these, the benefit. One of the issues that, just like again in Uganda, is the onerous registration process and documentation. And of course, of a bit of ambiguity when it comes to eligibility. And that's when you can get to a place you find that those people who really deserve to be benefiting or to be enrolled and recruited and be in the system, but they are not because of issues including corruption, for example. And the issue of unpredictability when it comes to when this, for example, cash transfers are being done, and them also being inadequate, because at times, if you've taken if you're supposed to get the 2,000 or whichever amount of money at a particular time, but it doesn't come through because of other bureaucracies or the way the systems have been set, then it becomes a challenge that you cannot even plan or budget with it. It also goes further to tell us, of course, there is limitations in terms of the resources that will be available. We have so many people who could benefit, who could potentially benefit, but then the resources are really not adequate to cover them all. And as we know, the government of Kenya, of course, there is what the contributory mechanisms like NSSF, the occupational and the private sector pension schemes, the social health authority, the schemes that we are paying the 1.5% or 2.75% for healthcare, and of course others as people get to contribute. But in all this, of course, there are other areas, other challenges that of course were coming through, including weak grievance systems or channels, and some of these projects could, especially those that are provided by non-state actors, could be short-lived and really not very sustainable. Moving forward, beyond the benefits and the barriers, the women told us, go to the next slide. Yes, there are a few things they aspire. For example, they aspire that if social protection mechanism really is gendered in terms of is engendered with the sensitivities of really the needs and not categorizing all the groups as one, then it they should, that such mechanisms which could be responsive are those ones that take into consideration the intersectional considerations, be issues of age, disability, caregiving, and of course where someone is or lives, residence and livelihoods. And we would find women, one is old, she's disabled, then of course she's widowed, she's living either in a rented facility, she has no property. So all these aspects would continue to make her more vulnerable. But if programs can really consider and quantify what that would be and to meet her needs, then that is what they're looking for. They're looking forward to dependable, predictable, and of course, adequate support coming from the government, but not just for consumption. And they're not just about a consumptive economy. They're looking at a social protection mechanisms that could help them really start thriving. They don't want to be in the registry forever. If they are able to be empowered and really come out of the registry and give room to others to come in. So if the process can be simplified, if the payments could be, of course, really be flexible in terms of even taking care of those that are not digitally savvy. And if there will be aspects of early and continuous co-designing with the women themselves, having their lived realities integrated into program design, then of course, having feedback mechanisms. At the end of the day, they're looking at that being one of the best ways that the existing mechanisms or the future ones that would be designed be more responsive to their needs. Go to the next slide, please. As we come almost to the end of this, we asked them what would they recommend, and there are a few recommendations. If I can pick a few of them, is number one, of course, they are talking about we should really continue, of course, to harness the national momentum as far as SP reforms are concerned. In Kenya right now, we are at a very good place because just recently, last month, or earlier last month, yes, the president ascended to the Social Protection Bill, which is now Social Protection Act of 2025, which now recognizes even and other categorizations, including women or in unpaid care, being part of the categories that can easily benefit from social protection mechanisms. Now, that is what we are looking forward to, and that is the momentum that we want to sustain. Of course, the aspect of engaging beneficiaries in the design, the delivery, and of course, improving the relevance and ownership of the processes. That is another recommendations they're making, and including having the eligibility criteria and of course, how they're being onboarded, like the identification process, the recruitment, the enrollment, and of course, how they access the services be one that is predictable. And one other thing they ask for is, of course, institutionalize a robust mechanism, sort of a feedback loop, which is missing at the moment. But the good thing, again, as I say, in the current act, there is an entire section that would handle grievances that will be coming from beneficiaries, but of course, on the other side of government. So I think that brings us to the end, though there is much more, and we're going to share the links right now in the chat box for you to follow through the reports. Thanks. Back to you, Lynette.
Thank you, Crispin, for giving us such a passionate.
Can I just mention something? Just one thing, yeah. Just to mention something very important, that although the data was collected from the sample that we have shared with you, it is very important for us to note that findings from this study offer rich lessons to some of the issues that need to be addressed to improve the design, the delivery, and the reach of social protection in both Kenya and Uganda and the region at large. Thank you.
Thank you, Chirabo, and thank you, Crispin, for giving this topic such justice. Okay, I would like to urge the members that we can use the Q&A to bring out the questions as we move along, so that they can be answered by Crispin, Chirabo, and all the panelists that I have on board. And as I keep capturing the questions, I would like to move swiftly to my panelists today. And considering that we've really had that the Kenyan women want to have a say, they want to be included in the design, they want to be heard. I would like to hear what my learned friend, Dr. Lynette Ochuma, how would you like to maybe respond to that from your policy experience in Kenya and the concrete steps that you've taken in monitoring and evaluation, which has been gender responsive? Maybe if you could like to highlight to us whether there are any gaps, how can they be tackled, and your experience in general. Thank you and welcome.
Thank you so much, Lynette, my namesake, and thank you all of you, and thank you for this great.
Video.
Thank you for this great opportunity that you've given me. I hope you are all able to hear me. Just to give an highlight of what we are doing in the social protection sector. Crispin, maybe you can mute. Can I continue, Lynette?
Yes, you can continue. I've seen he has been muted. Thank you.
Okay. Yeah, so just a preamble that Kenya, as we all know, it has a population of about 53 million. And out of this, we have 50.5 who are females and 49.5 from the Kenya Bureau of Statistics, the census that was done in 2019. So I would want to say that Kenya recognizes promotion of gender equality and empowerment as a critical element of combating poverty and stimulating sustainable development. And I think Crispin emphasized this, that even in our Constitution of Kenya 2010, all Kenyans have a right to social security. And this aligns very well to the Vision 2030 on equity and having a cohesive society, as well as to the Sustainable Development Goals. Now, just to go straight to the question that you've asked me, and with the experience that we have in the social protection sector, one of the things that we really need to emphasize on is on having a strong policy and institutional framework. So as a Kenyan government, gender has been explicitly embedded in the objectives of social protection programming. And one of the key things that we've done as a government is now we reviewed our social protection policy of 2011, and now we have the social protection policy of 2023. And as Crispin also said, we also have the Kenya Social Protection Act of 2025. And we also have the Social Protection Monitoring and Evaluation Framework that was done in 2018 and 2022. And this provides a structured approach to tracking progress. The second thing is that as a government, we need to strengthen on our data and indicators. In our State Department for Social Protection and Senior Citizen Affairs, we have all our data done in, we have data that is disaggregated based on sex. And the data that we collect, for example, we have the harmonized targeting tool that is used for targeting beneficiaries of social protection. It has been provided for in a very granular level where we have included demographic and socioeconomic and service access indicators. So that already shows that we are trying as much as possible to ensure that we are sensitive and responsive to the gender issues. So the M&E framework that we have provide gender sensitive indicators that track outcome beyond income. In all our social protection programming, we have ensured that our officers are trained. And before we even start any program, we align ourselves to the environmental and social standards framework, where we ensure that we capture the gender issues and come up with mitigation measures. For example, currently we have the Kenya Socio-Economic Inclusion Project that just ended, and we are planning for KSEP 2 And within it, we have ensured that we've captured the gender issues and the gender concerns. And if there are any risks, then we've tried to mitigate it by coming up with gender plans. So we also need, as you've rightly said, we also need to integrate gender issues and also ensure that the women participate. From your data, you have indicated that the women do not participate. But in all our social protection programming, as a government, we always make sure that the women are involved. For example, talking of the social assistance program, when we were doing targeting, and even currently, what we do is we make sure that we do community-based targeting, where both the men and women are involved in identifying the poor and vulnerable households who should benefit. So that is usually a collective exercise that is done at the community level. Even for identification of our economic inclusion program, and I'm happy that one of the panelists is from World Bank and has really participated in economic inclusion, and also being the lead in economic inclusion. One of the things that we do is we do community-based targeting, where the men and the women are involved in identifying the poor and vulnerable households. So this ensures that there is the issue of social inclusion, because even persons with disability are given a chance to participate. And we also ensure that there is accountability and there's use of evidence. One of the Crispin mentioned something about the feedback mechanism, and I think as a government, we've gone a step ahead. We have our enhanced grievance and management system, where the public and even our participants or beneficiary can raise their issues and concern. And one of the key things that we've put in place is we have a toll line, which is 1133, that captures the concerns and challenges that face both women and men, or boys and girls. And this has actually led to gender responsive programming. So those are the steps that we've taken as a government. And we have also ensured that we are gender responsive. Now, in terms of going to the second part of your questions, the gaps that remain and how we can tackle them, we realize that we have our social protection monitoring and evaluation framework, where we are able to collect data, the sex disaggregated data, and even look at it in terms of the adolescents, the older women, the persons with disability. But it is very limited, and we've not been able to utilize it so well. So one of the key things that we should do is to ensure that we expand our indicator framework, and that would ensure that we at least capture all the aspects that we need to monitor. Another gap is that we've realized, we have the national government and the county government. We have the monitoring and evaluation officers, but most of them are not trained on gender issues, so that even as they implement the social protection programs, that they can wear that gender lens. So one of the key things that I think we really need to enhance on is to ensure that we develop county-specific integration plans, and also facilitate peer planning between the national government and the county government. So we should scale up the issue of training and institutionalizing issues on gender. And I think Crispin also mentioned the issue of intersectionality, and we realize that that is a gap. Yes, we have the sex disaggregated data, and we even have data on disability, marital status, their location, But I think we need to strengthen the participatory aspect just to ensure that the women, the men, the boys and girls are also involved in monitoring and evaluation. Most of the time, you'll find us engaging experts to do the monitoring and evaluation, and the community itself are not involved. And it is right from what has been presented that sometimes they are not fully involved. So it would be good to ensure that we involve them. So the communities might be represented, but we need to be more deliberate on having participatory monitoring and evaluation approaches that ensure that the grievances of the women, the men are listened to. As I conclude, there's also the issue of underutilization of the gender data. We have a lot of data that is routinely collected, but we do not consistently apply them to inform program design, budgeting, or policy reforms. So it would again be good to strengthen the institutionalization of the gender analysis in program reviews and even when assessing the impact. So in summary, I can say that Kenya has laid important foundations through policy, data capacity, participation, and reforms, but the journey ahead is still great, and we need to be very gender sensitive in our systems to ensure that we are gender transformative. So that means that we need to include and ensure that we empower the society so that they understand their rights. Thank you, Lynette.
Wow, thank you. Thank you for such insightful remarks. And we are happy to hear the strides that the government has made. Considering that Chirabo said the findings are mixed and some women are appreciating that this is helping them and some are saying it's not reaching them. I would like us to hear from my colleague Beatrice Okilani to let us know whether these SP programs are reaching those who need them the most. And also from the policy perspective, let's hear what reforms are needed to shift these narratives so that we can ensure that these programs reach the marginalized women or those who really, really need this service. Beatrice, if you can just highlight on those aspects. Thank you.
Okay, thank you very much. Yes, this is Beatrice again. I'm going to take you through what is being done in Uganda briefly to ensure that the vulnerable groups and especially women can access social protection interventions. I would like to start by giving a definition of social protection in the Ugandan context, considering the fact that social protection is nascent in Uganda, and we would like to be able to promote a sector that can easily be understood and appreciated. That when we talk about social protection, this is what we refer to. So in the Ugandan context, social protection are public and private interventions to address risks and vulnerabilities that expose individuals to income insecurity and social deprivation, leading to undignified lives. It has two pillars. One is social care and support, then social security. Social security are interventions to mitigate income shocks. Under social security, we have two components. The first component is the direct income support, which is internationally referred to as the social assistance. And this we define as non-contributory regular and predictable cash or in-kind transfers. So they are non-contributory, paid from the consolidated fund by taxpayers or by development partners or any other stakeholder. But they are regular and predictable, that the beneficiaries can plan for it and know that it will come at a time when they know that it should come. The second component under Social Security is social insurance, or what we refer to as the contributory Social Security, which are really risk-pooling interventions. And these mitigate shocks relating to retirement, loss of job, sickness, infirmity, disability, and that category. So that is what we refer to as Social Security. And the NSSF, the public service, pensions are all under that. While under direct income support, we have the Senior Citizens Grant, we have the Labor Intensive Public Works, and various types of grants, which as well as the food aid that is given to persons in dire conditions. So for the second pillar of social care and support, these are services that provide care, support, protection, and empowerment to vulnerable individuals who are unable to fully take care of themselves. These are really services, for example, that we give to the children on the streets, the support, the care, the protection for the children, even in homes under child neglect, those under abuse, the support that is given to persons with disability, as well as rehabilitation, the support that is given to older persons to help them with their daily living, to help them access medicines or care, that is services. So that is it. And under social care and support, we have what we call, my background is a little bit noise, personal care, then we have the protection services, then we have safeguarding, then we have empowerment, and then we have what we refer to as specialized care for those categories. And then we have what we refer to as complementary services. We recognize that there are some interventions that are implemented by government and other stakeholders that contribute to building resilience, which is really the role of social protection. But we do not categorically define them as social protection, but we know that they contribute. And such in our context, for example, we have a special enterprise grant for older persons. This is a grant that is given to older persons aged 60 to 79 years. It is a grant for them to do some income generating activity to maintain livelihoods. Then we have the special grants for persons with disabilities. This is also a grant given to women in group, persons with disabilities in groups to do to enable them to do some income generation activities. So they are grants, they are not refundable. Then we have the Uganda Women's Entrepreneurship Program and the Youth Livelihoods Program. These are grants, these are actually loans that are given to women and then young people, youth in groups, that are given in groups. And then we have what we call the parish development model, the UPE, that is the universal primary education, and the universal secondary education. We categorize all these as complementary services. We don't define them exactly as social protection, but we recognize their role, and we agree that they all have to be operational if we have to have a resilient family. Yes, and then there are risks and vulnerabilities that we have identified across the life cycle, from early childhood to school-going age, to youth age, to working age, up to the time of old age. There are various risks and disabilities that affect individuals, and we have looked at the vulnerability rates according to the census as well as the national household surveys that are done here in Uganda every other 2 years. So we have seen the risks, but when you look at the risks that are identified here, most of them actually, it's the women who bear the greatest burden of these risks. When you look at the malnutrition rates, which are quite high, this is also a burden for women, 29% malnourished, underweight. About 20% of the children haven't received vaccinations. 80%, about 80 don't have birth certificates. And then 3.5 of children 2 to 4 years live with a disability. So these all affect women in various stages. When you look at the school-going age, again, you see the teenage pregnancy rate is quite high. Women, as girls, at 25%. Just about less than 50% of the children can complete primary 7. You find that HIV infection is mainly on adolescent girls. You see girls again. Girls are married off at early age. When you look at the unemployment rate among the youth is high as compared to the national average. So there are those vulnerabilities. But again, disability among the school-going age and the youth is also high at 7.5%. The working age, of course, there are also vulnerabilities relating to unemployment, but also the care burden of women is considered under that. Limited jobs and also limited the coverage of social security as already identified by Chirabo earlier in the study. When you look at old age, about 45% live in poverty, while only 20% can access credit. About 26 of them are caring for children. And you know, when it's caring for children, it is a woman, so it is the older women. And then, of course, there are issues of limited support. But even in spite of this, there are also some risks, including shocks that are prevalent, especially climate-related shocks, droughts, floods, landslides, and all these affect, the food security. And again, you know that it is the women who will be affected by that food security. So we have looked at all this as we design social protection programs and then what the interventions that have been put in there.
Yes,
so what have we done so far?
As you continue, I just wanted to you to just summarize and highlight the policy shifts or any reforms that you are doing in the interest of time. Thank you.
Yes, so we are here. That's where I am now. That currently the government has rolled out the senior citizens grant and provided 1.121 billion for it. And then we have amended the NSSF Act to provide midterm access as well as voluntary contribution, which allows now women also to be able to contribute to that NSSF. We have developed a strategy for extending social security to the informal sector. Again, in Chirabo's presentation, you indicated that women, a majority of women are in this sector. And then when we roll out this strategy, we hope that we can be able to bring the women on board. We have drafted a national health insurance bill, which is still under consideration. Again, this will enable the women to be able to access the much needed healthcare services. And you know that the women are the ones that use it so much. We developed a framework for social care and support system in Uganda. And this framework is mainly to support, is providing care to the vulnerable, and the interventions herein support the woman to undertake that care role and also provide some space, and how can she be supported to undertake that care role by the community, by the people around about her, but also formally, the formal institutions, how can we support the woman? And then we have a strategy for mainstreaming gender in social protection programming. The strategy is operational. We have also have coordination mechanisms, just to understand that social protection is implemented by various institutions, and so there is a need to coordinate that social protection. And so we have developed coordination mechanisms right from the grassroots national level up to the grassroots level, to try to bring this all together so that the women and other vulnerable persons can be able to access interventions as and when they require. This is just what I said. We are also designing a severe disability child grant. We are rolling out an integrated early childhood development programs, and then we expanding nutrition sensitive programming to throughout the country. That is our plan. And then also we are looking at expanding adolescent-centered social protection programs. This really aims at keeping the girls in school. And then we are also currently, together with their development partners, piloting a program that supports transition from primary level to secondary level. Those are some of the things that we are doing. We're also looking at lowering the eligibility age, but looking at the system strengthening to make sure that we can be able to capture the women, the issues that the women talked about, targeting, identification, selection, and the payment mechanisms. We are also doing some work around that. We are strengthening the policy and legal framework for social protection, governance mechanism I've already talked about. The selection mechanisms, we are working on establishing a social registry, working this together with the World Bank and World Bank supported project that is upcoming, which is the NUSA 4. We think that this will enable us to register all the potential beneficiaries, such that when we are targeting, we are able to identify those in need, including women, including the persons with disabilities, including children and all that. But also the payment mechanisms, we are doing some work around improving the payment mechanisms so that we can try to, instead of paying cash online, we're trying to see, can we be able to do e-payments? So we also at the point, or we have developed a strategy, but now we are going to pilot that. We have also improved on the complaints and grievance mechanisms. We have developed a national grievance strategy, which can be which is supposed to guide social protection interventions, but also strengthen the monitoring. I talked about the social registry already, monitoring and evaluation, strengthening. Again, we have the strategy there, but also we have developed what we call a disability blueprint, which guides stakeholders on how to provide the services for persons with disabilities. And then we want to strengthen linkages and synergies, because we know that in existing programs, if we are able to link those vulnerable women, vulnerable people, they should be able to access those services, including, for example, the parish development model, but also how can we, because if, for example, if we give the parish development model to an individual and then there's sickness in the family, somebody can spend all that money, but it's important that there is medical, some health insurance that is done along the way. So that is what we are proposing there.
Thank you.
Going forward, this is just the coordination mechanisms which we have already established. We have the coordination mechanisms at the national level. We have a social protection thematic committee. Then we have technical working groups based on the components of social protection. At the local government, we have a coordination, and then lower local government, which is the sub-county, we also have coordination mechanisms. What are our proposals going forward? That we need to amend the National Social Security Fund Act to provide for pensions. And this we think that will be able to support the women there as well, but to extend to roll out the strategy for extending social security to the informal sector, to expand these nutrition sensitive social protection programs, and then to enact that national health insurance bill is what we are working towards. But the bold steps that we are looking at doing is that we are trying to advocate that government should provide for at least 3% of the national budget to social protection. And we are trying to undertake a study to understand how natural resource revenue can be allocated, a portion to social protection, a percentage of it. For example, we have oil, our oil revenue. We are trying to undertake a study on the Alaska and the Norwegian models. How can we provide some social protection, some percentage to social protection, so that those that need that social protection can be covered under the available resources. I want to thank you very much.
Thank you. Thank you, Beatrice. Your strategies are rich. We would like to have our attendees interact with your presentation. It's really rich. I'm kindly requesting that we take like 10 minutes of your time so that we can really listen to what our panelists have. We are really almost 3 minutes to the time, but I'm kindly requesting that we hold on a little bit as we listen from the World Bank and hear what is the donor doing to ensure inclusive social protection programs. From the inclusion point, what is the role of the donor? How can they go beyond just funding so that they can ensure that these social protection programs are well inclusive and accommodative to what the women needs? Nazia, please welcome. Thank you.
Thank you so much, and hello to everybody. I'm from the Partnership for Economic Inclusion team within the World Bank. So we are housed within the social protection global practice, but we work with governments and partners to help the adoption and scale up of economic inclusion programs. So today in my presentation, I will talk about the landscape of economic inclusion programs, how they build on social protection, what is some of the evidence, but then also where are some of the gaps and what is the World Bank doing to promote the further scale up of these programs. So I'm going to share my screen very briefly, and I know we're short on time, so I'll try to keep my presentation brief. So hopefully everyone can see my screen, but just to provide some context, we've already talked about this, and I know all my other panelists have, fellow panelists have covered this very well, but we are, living in a time where there are multiple crises. We just are, recovering from the COVID pandemic. There's also food insecurity challenges, climate change challenges, and then fragility, conflict, and violence. So in general, we know that the impact of these crises disproportionately fall on women, particularly, which is why it's very important to have adequate social protection coverage of women, but also complementary programs that help build their resilience. Beyond the crises, we're also faced with a major jobs challenge. Today, around 400 million people are currently unemployed, with majority of them with women being the ones who are facing the biggest burden of this, primarily in the low and middle income countries. By 2033, the Global South will host about 1.2 billion people between the ages of 15 to 24. So we have this bulging youth population, but not enough education or employment opportunities. And we're at risk of having 300 million young people be inactive by 2033. Informal sector jobs, as we know, are the primary pathways for a lot of the low-income and vulnerable groups to earn an income. We want to make sure that these informal sector jobs are, while we recognize that they provide poor working conditions or have low wages, we want to make sure that they're still accessible to those who need them the most, and that we can improve the quality of these jobs so that people can start building some resilience. So with that goal in mind, the World Bank and other partners have been working in the economic inclusion space for quite some time. Just to define what these programs are, they are multifaceted programs that include a lot of different interventions that build on social protection. So they're the primary ways by which the productive potential of those who are poor and vulnerable, particularly women, can be unlocked, and these programs really help them increase their income and assets in a sustainable way. They generally, as I mentioned, they generally build on social protection programs such as cash transfers or public works programs, and they introduce interventions such as skills training, business capital, coaching, and market linkages to really help populations start generating income and build sustainable livelihoods. These livelihood opportunities, or the business capital that are generally being provided through these programs, focus on self-employment. So they generally tend to be small scale micro enterprises, non-farm work, or other livelihood activities. But there is a big focus on connecting people to markets, which we know is one of the quickest way to get people to start building resilience. In terms of how these interventions work together, so these are programs that are integrated. They look very different depending on the context, but generally these are the interventions that you would have in a comprehensive economic inclusion program. I won't go through each of them, but just to say that you have the income support which you get from social protection programs, so cash transfers or public works wages. Those combined with business grants can really help women meet their basic needs, but then also start generating income and achieve some sort of economic independence. We also have the skills development component, so life skills, which focuses on building, working towards goals and building a positive vision for the future. And then you also have technical skills to help families and women and their household members to build the capacity to manage livelihoods in a sustainable way. And then lastly, coaching, which is a very integral part of economic inclusion programs. It involves the regular follow-up and the guidance needed that poor and vulnerable people often lack. So this guidance really helps them build social capital and increase their agency and manage the livelihoods, but then also take advantage of other social services that are available in the area. So I wanted to very quickly share one program from Zambia that has shown very positive impacts on women's outcomes. This is a program called the Supporting Women's Livelihoods Program, and it has been in operation for quite some time. It's implemented by the Ministry of Community Development and Social Services, and it is focused on promoting human capital development of vulnerable girls and women. To date, almost 145,000 women have been reached through this program, and there are plans to reach up to 200,000. Hopefully, we can even scale up even more. This is a World Bank finance program, but of course, with great support from the government. The interventions in this program include productive grants, business and life skills training, and then also group mentorship and savings groups. The impact evaluation from this program shows that there are great benefits. We see that there's 30% increase in consumption and 80% increase in business profits 3 years after the program implementation. So not only are we seeing positive impacts, but we're seeing that these sustain over time. We're also seeing improved well-being among women. So the indicators that were measured look at perceived happiness and mental health. So it's good to see that there's progress in both economic and non-economic outcomes. And lastly, we're seeing high cost effectiveness with every $1 being spent on these programs, yielding about $1.3 in benefits. So there are many other programs that have similar positive impacts, but I just wanted to share this one that has been running for a while and has reached scale and is still ongoing. So in terms of the global landscape, we have identified over 400 economic inclusion programs across 88 countries. 90% of these programs target women, which is great, but we know targeting women is not enough. We have to be a little bit more intentional with providing gender responsive interventions. So only 1/3 of these programs have women's economic empowerment as a core objective. So we know that there's a big gap that we're seeing in these programs. Just to give you a sense of what these programs are doing in terms of meeting gender outcomes, they've really prioritized community sensitization and tracking gender outcomes. So the programs are doing a really good job of this. But where we're not doing a very good job is, we're not addressing childcare constraints related to childcare, elder care, and then also social norms that often prevent women from engaging in the labor force. So there's definitely a lot more work to be done. So I wanted to leave you with some key considerations for how to design gender responsive social protection programs, particularly economic inclusion programs. And number one, having gendered assessments or gender responsive assessments are very important. So first step is to really identify what are the vulnerabilities that women are facing in that specific context, and what are the interventions they need to overcome that constraint. Number two is addressing social norms. This can be done through training, coaching, and community sensitization. And this, we know that, just providing livelihood opportunities to women are not enough if we are not addressing the factors around them that affect their ability to participate, right? So if we are not changing the social norms in a community, then women will not be able to succeed fully in the livelihood space. The third consideration is to address the unpaid care work problem that we're facing. So this involves providing more childcare services within communities, but also addressing the social norms that affect the uptake of these services. The fourth consideration is to engage men. We know that economic inclusion programs, as I mentioned, they do target primarily women, but they take on a more household approach. We know it's important to make sure that men are also on board and support women in this program to prevent, so that there's no negative dynamics or no gender-based violence that can result from women being more economically empowered. So this is very much a household approach, and it's important to engage men and other household members in the community in the program. Lastly, at the policy level, it's very important to address some of the legal barriers that affect women's participation, whether it's ease of starting a business, access to financial services that can help women expand businesses. We know that there are a lot of discriminatory barriers that exist, and in addition to supporting programs, we must also work at the policy level to address some of these legal barriers. So in terms of what the World Bank is doing, the social these type of economic inclusion programs are increasing a lot within the social protection space at the World Bank. We now have a new target of reaching 500 million additional poor and vulnerable people with social protection programs by 2030. This, we know we cannot do this alone, and we know we will be relying heavily on our partners as well to achieve this target. But a key portion that I wanted to draw your attention to is of that 500 million, the goal is to reach 250 million. So half of those will be women, right? So there is a big focus on not only expanding social protection coverage, but making sure that we are reaching women and including them along in that journey. So, a lot of work to be done, but we will be working with our partners to reach this very critical goal. But I wanted to, in the interest of time, I'll leave you with this new report that we have released in November of last year. This provides more of a broader landscape of the economic inclusion programs that I talked about. So we are featuring almost 400 programs across 88 countries. So I encourage you to take a look, and we'll be sharing this slide deck for further details as well. Thank you.
Thank you very much for those insightful remarks, and we are happy to hear that the donor is really keen on the inclusion of women, and also bringing the men on board to avoid backlash, so that we are all included in this. So I would love to quickly go to the questions. I've seen most of the questions have been answered in the Q&A. Maybe I can see only two, and even as I just try to address them, I would like to I would like to also give the the attendees just some few seconds if there is anything from the findings that you found unexpected, or maybe like it comes out. Oh, I think I didn't expect this. Were it not that evidence has said it, then I will give you time to just maybe 2 seconds to give insights that align with what maybe the findings have said, or what is unexpected, and maybe what we can prioritize going forward. So as I wait to see if there is any hand, I would like to just address this question to Beatrice. Beatrice, someone is saying we need a recommendation for Uganda on the increase of SAGE from 25,000 Uganda shillings to 75,000 monthly, because looking at the current context, 25,000 is nothing. Maybe you would highlight that one. And also Nadia is also alluding that this free service may not work. Maybe we look at how we can make programs work by maybe co-sharing or empowering the women through entrepreneurship so that they can also finance some of this. I don't think I've seen any hand from my end. I would like to just hear from Beatrice. Is it possible to increase that, or if not possible, are there plans? Just in 1 second, Beatrice.
Thank you very much. Yes, indeed, increasing the value of the SAGE Senior Citizens Grant is on high agenda, and it has been on their agenda for the last 5 years. When the Senior Citizens Grant was rolled out in 2018, Parliament recommended that we will be lowering the eligibility age in a phased manner. Every year we're supposed to lower, but also increase the value. And so the technical people, we have done the analysis on how much government would need to make sure that we lower the eligibility age, but also increase the value. And the figures are quite high. It's difficult to make that leap, but it is in progress. Currently, what we are pushing is lowering to at least 75 years and then increasing the value to at least 35,000. So we have modeled increasing to 35 to 50, actually, and then 100 also. But when you look at the figures that come out, it is quite high. So we are moving ahead with lowering the eligibility age to 75 and increasing the value to 35. But of course, it is still advocacy that needs to be done, so that some budget is allocated to social protection to make us realize that. Thank you.
Thank you. I see Nadia's hand up. I don't know whether she's capable of speaking.
Hello.
Yes.
Hello.
Yes, we can hear you.
Oh, I wasn't having the. Okay, good to know. Thank you so much for all the presenters. It has really been very insightful. However, as a nutritionist who has been trying to integrate finance in my interventions, I see a gap. We have all these services that are being pushed to, to support the mother or the woman or the family in general are so broken. Like, they are very individualistic, and you find that there is a lot of incompleteness when it comes to the services being provided, but also the resources are being highly strained. the resources are being highly strained so we find that very few people get to benefit from this. And even the ones who get to benefit, they still benefit at inadequate level. So I don't know if there is any intervention that we are doing as you know, the different stakeholders to see that we merge all these services. Personally, I am looking at how do I bring finance in nutrition. So one of the things that we get to do at LifeX Africa, my company, is we have conversations with mothers. When we are designing meal plans, we also ask what are their nutritional budgets in a month so that they can easily adhere to these meal plans. So how else can we get to merge all these services so a mother or a family can get complete, you know, services of social protection in one or the other? Thank you.
Thank you. Thank you, Nadia, for those wonderful remarks. I've seen a question whether Kenya has a national insurance, which Uganda does not have. Yes, Kenya has, and Beatrice is here. She takes that into consideration so that they can incorporate it into those strategies that she was highlighting. Just in the interest of time, because I can't see any other hand, I would like to welcome Crispin to just give us closing remarks, and maybe if there is any question that I have not been able to get attention to, he can answer as he gives us closing remarks. Crispin?
Thank you so much, and thanks everyone who's been so patient since we began until now. Thank you, Nadia, for the question you've just rightly asked, and of course that's what we are looking forward to, a social protection mechanism that would really take into consideration some of these critical needs, because again, we realize if the health is compromised, then the rest of the other things that as individuals, as families, as countries invest in would also be compromised and will not get the best value of some of these investments. I thank you, Nazia, for the presentation, and for sure, I already downloaded the report. We are looking into it as well and learning, especially the example you've given from Zambia, and the fact that they are already is scaling. And you realize that it's not always easy to scale some of these programs, but I think where the bank has invested in, and as Dr. Lynette said earlier, the bank has invested a lot in the Kenyan Social Protection Program, and we would want to see how then do we, moving forward, as we make those recommendations of making it more equitable, that we can make it more practical, and as we monitor, we'll be having sort of milestones that we can reach to each year, each period of when we are able to measure whether we are making progress, and if at the end of the day, the women that we are talking about and their households get really to benefit and thrive. Lastly is the issue of male engagement. Yes, the concentration on one hand could be seen to be on the side of women, but the male engagement is very important. So, but in the sense that we are not bringing men to be sort of in between women and their benefits. And in this case, if the design would give women control, that agency, so that they are able really to feel that they are in control of the resources they are receiving, that would be great for themselves, for their families, and of course for the nation at large. And thank you, Dr. Lynette Ochuma, for representing Kenya and all the facts that you've put on the table. We want to trust that the momentum has already been set. We'll be able to ride on it. Churabo, thanks for the presentation on the Uganda findings. And all of us who are here, we are sharing the links on the emails, the email that has been asking you to join in. We're sending the links, we're sending these PowerPoint presentations, and let's interact. Thank you so much, and see you in other forums as we continue to advance gender responsive social protection mechanisms in Africa, for Africa, and within our countries and our programming. Thank you.
Thank you, and bye.
Social protection encompasses policies and programs designed to safeguard individuals and families from risks, vulnerabilities, and potential hardships throughout their lives. But here's the reality. Not everyone gets access to this essential lifelines. This is a story about the women often left behind, women in informal settlements, rural areas, and those in vulnerable jobs who don't benefit from cash transfers, healthcare support, or employment schemes. These are the voices from the margins.
Tariffs are not legal. It's a structure. You know, how our economy is organized. We have to know that our economy is an informal economy. It's first subsistence and informal. But these instruments are assuming that we're in the formal. You know, so we have legislated for the formal sector. But the economy is, you know, people in the agriculture, subsistence agriculture, you know, and the informal sector. And they are completely outside the social security safety net.
To better understand these challenges, ICRW Africa conducted a qualitative study in Kenya and Uganda, speaking directly with women to understand their experiences, perceptions, and aspirations in regards to social protection. We focused on women living in rural areas, single mothers, widows, elderly women, those in informal jobs, unemployed women, and women with disability. What we found was eye-opening. Many women face real and frustrating barriers, from complex registration processes that require a series of documentation which they often don't have, to limited awareness of what social protection programs even exist. Corruption and favoritism that block fair access, hidden costs of social protection, and strict rules that leave out the vulnerable. The women bemoaned the red tapes denying them access to the help they needed. One woman said, "On the radio, they say parish development model funds are free to access, but on the ground, the official asks for 100,000 shillings. By the time you get your 1 million shillings, you've spent 400,000 shillings, and someone else still wants a bribe to help you finish the process of accessing the development funds." What these women are asking for is simple: fairness, accountability, and dignity in accessing social protection programs. They want programs that include everyone, especially those in vulnerable and marginalized groups. They called for better transparency in selecting who benefits and stronger systems to reduce corruption. For instance, surprise visits, community oversight, and hotlines for feedback. Many also stressed the need to improve healthcare and education services as part of social protection. Also linking cash aid with real economic opportunities, things like skill development, business training, or job placements, so they can build long-lasting financial security. So, what actually works? Our research found that effective social protection interventions in Sub-Saharan Africa look like this: direct cash payment, access to land or farming resources, food support, credit and financial services, health insurance and universal coverage, employment guarantees and public works, education subsidies and child grants. And lastly, laws that protect women's rights and safety. These programs aren't just about survival. They help families to thrive, improve health outcomes, support mental well-being, and ensure girls stay in school. We learned that too many social protection programs in Kenya and Uganda overlook women's specific needs. We can and must do better. Here's how. Use inclusive, gender-sensitive targeting, involve communities in design and delivery, make systems more transparent and accountable, share information widely and boost financial literacy, invest in quality services and infrastructure, use technology to make access and accountability easier, and link social protection to economic empowerment strategies. These women didn't just share their struggles, they shared solutions. Their lived experiences offer a roadmap to build better and fairer social protection systems. To truly make an impact, we must shift from bare minimum support to a rights-based, gender-responsive approach that centers the voices of the most affected.
Oh, good.